Welcome to your Aged Care Compass podcast. Join us to find out how to support your older loved ones at home. We're going to help you make sense of Australia's aged care system. We talk about legal and financial considerations for ageing and how chronic health conditions impact your older loved ones' well-being. And we share real-life stories of where it went wrong for people and how we got them back on track.
Welcome to episode 10 of your Aged Care Compass podcast. Today we're talking about the Dementia and Cognition Supplement. Coral, what is the Dementia and Cognition Supplement?
The Dementia and Cognition Supplement is extra funding on top of a home care package or home care package funding, Shell. So people must have a home care package in the first instance to be considered eligible, which means they must have been assessed by the aged care assessment team and they must be actually receiving that home care package.
Okay. And who's eligible? Does someone need a diagnosis of dementia to be eligible?
No, they certainly don't. And this is one of the biggest myths that we hear all the time, that people need a diagnosis of dementia, and they do not. So people are eligible for this additional funding if they meet a score on one of the prescribed screening tools that the department says that we must use. So having a diagnosis of dementia, it doesn't mean that people automatically qualify for this additional funding. Impaired cognition as well isn't exclusive to dementia. So people can be cognitively impaired from a stroke or other brain injury or from some other health conditions or medication. This is why this supplement is known as the Dementia and Cognition Supplement. It covers impaired cognition regardless of the reason.
Right, okay. So who can screen for eligibility and what are the screening tools?
So there's only a very small number of clinicians that can screen people for eligibility for this supplement. So registered nurses can do this screening. Clinical psychologists can do it as well, and so can medical practitioners or doctors. So your GP or your geriatrician can screen for this supplement.
Yep.
We'll talk about these screening tools in a minute, but there is one of the screening tools, the cog, which is specifically targeted at our First Nations people. Clinical psychologists, they can't do the screening with the cog unless they've been trained to do it. It's important to be aware that the ACAT assessment and getting a diagnosis of dementia and screening for this supplement are three separate assessments. The ACAT cannot screen for this supplement. You must be receiving a home care package to be eligible. So the ACAT is assessing and approving people for home care packages.
Yep.
But then there's this time frame where people are waiting to receive their home care package. And it's not until they get the home care package and then if they demonstrate a level of impaired cognition that they would be eligible. You know, people say to us, why didn't the ACAT do this when they were assessing? And it's specifically for that reason, because you must be receiving a home care package first and then demonstrate the eligibility of impaired cognition after that. Diagnosing dementia is a process in itself, and it has no bearing on demonstrating need. So screening for the Dementia and Cognition Supplement is a standalone process.
Right, okay. And Coral, what's the supplement worth?
So the supplement is worth about 11.5% of the value or the subsidy of the level of home care package. So if someone was on a level 1 home care package and they were eligible for this supplement, at this point in time in June 2024, it goes up every 12 months, on a level 1 home care package, a person would get an additional $3.24 per day. On a level 2 package, it would be $5.69 per day. A level 3 home care package is $12.39 per day. And then on a level 4 home care package, people get $18.78 per day extra. And for a level 4 home care package, what that equates to over a year is just over $6,000 $800 a year. So not an unreasonable amount of extra funding that can go towards caring for an older loved one who's cognitively impaired.
Yep. So let's say someone's been screened for eligibility. What happens after they've had that screening?
So the screening process would happen with the older person themselves or in one of the screening tools that we use, the psychogeriatric assessment scale. There is also the option within that particular document to defer to like the caregiver or an informant, as it's called. So the screening process happens. And then the registered nurse, psychologist, or the doctor completes their details on the application form. It's just a double-sided document from Services Australia. The clinician completes their details. Then the provider also completes their details on the application form. And then the form is sent off to Services Australia for processing.
Right. And Coral, I realise we didn't actually talk about what the screening tools are. So probably best to mention those. What are the 3 screening tools that can be used?
Yeah. Glad you circled back to that, Shell, because there's a lot of confusion around this as well. So the prescribed screening tools, the only screening tools that you can use to demonstrate eligibility for this additional funding, the Psychogeriatric Assessment Scale, or the PAS, the Roland Universal Dementia Assessment Scale, or the RUDAS, and then the Kimberley Indigenous Cognitive Assessment, or the KICA-COG. So we'll talk about a couple of scenarios shortly, but you cannot use the mini mental state exam or the MMSE, which is probably a cognitive screening tool that most people are more familiar with. We hear people talk about, oh, they ask mum or dad the 30 questions. And most of the time that means they've been asked the mini mental state exam in a process of cognitive screening, but you can't. If in this instance, if a registered nurse used the mini mental or a geriatrician or a GP, which it does happen, Services Australia will knock it back. Even if that person demonstrated eligibility on another form, if you put and it doesn't make, this is the other thing that we hear, that sometimes a geriatrician might write a letter as well because they don't agree with the screening tools, and they write a letter of support to Services Australia, and they've deviated from these very specific 3 screening tools, and these applications get knocked back.
So just as a very quick touch on, who would use the RUDAS as a screening tool?
The RUDAS is specifically targeted at people from culturally and linguistically diverse backgrounds. So English not as a first language.
Okay. And the KICA-COG, I know you mentioned before, for First Nations people?
Yes.
And is that any First Nations people?
The KICA-COG, it was designed for like community dwelling, regional, rural, First Nations communities, not really city metropolitan, but it does happen. And certainly if you're in one of our major cities and you're a registered nurse choosing to use the KICA-COG, that would be accepted as well.
Okay. And then, so for everybody else, it would be the PAS that would be
the PAS.
used? Yep.
That's it.
Yep. Okay. All right. So let's say the screening happens and the person, they've been deemed eligible, the application's been processed and they get their supplement. What happens if someone's home care package level changes or they change providers? Does this affect the supplement at all?
It does, and it affects it in, well, the first part of that question, if they change level of home care package, we know that people go up in levels of home care packages. So what does that mean? It means that the amount of funding or the amount of supplement that you're going to get each day is going to increase. So going up from level 1, $3.24, right up to level 4, $18.78. As you move up through those 4 different levels of home care packages, that amount of additional funding you get per day increases as well. So that's great.
Yep.
When people move to a new provider, this supplement is supposed to follow people seamlessly from one provider to the next. But what we hear back from providers is in that transition process, when people are moving from their old provider to the new provider, sometimes in that transition process with Services Australia, I don't know, it gets lost and the new provider is not aware unless the recipient or the carer or the family member has spoken up and said, mum or dad are getting this supplement. They've highlighted it with the new provider. So we do hear that sometimes providers will just re-screen a person when they sign up with them. The new provider will re-screen them and resubmit to Services Australia just to make sure that it doesn't get lost in the system. It doesn't get lost in that transition process.
Yeah, okay. FlexiCare is a not-for-profit organisation which supports older people living in Brisbane's southern suburbs to live their best lives in their own homes and communities. FlexiCare don't have grand plans to be the biggest aged care provider. They want to be known for treating each one of their participants as an individual who they get to know well. They answer their phone calls personally when clients ring them. They give their clients easy access to a home care partner who can work with them to deliver the best mix of support possible. If you're in Brisbane South and want to know more, give their friendly team a call on 07 3422 8400 or check out their website flexi.org.au. And when the home care package level changes, that supplement automatically changes, doesn't it? Like nobody has to do anything. Yep. Okay. Should we talk about some of our experiences with?
Yes, I think we should, because we hear far too many times that people miss out on this supplement because either the provider is, they don't really know how this process happens, and also because the person screening, which we tend to find this happens more when GPs and even geriatricians, when they're screening people, this is where it goes wrong and people are deemed ineligible or they have their application knocked back from Services Australia. So when we're talking with people about how to choose a home care package provider, from my point of view, providers who have a registered nurse on staff, that's very attractive. So if a registered nurse is on staff with the provider, then the RN should know about this and should actually be progressing this when people sign up to that particular provider. There would be a conversation about the care planning, and when that care plan is being developed, the provider would be, and if it's a registered nurse developing the care plan, they'd be asking the family member or the spouse about functional aspects, but also cognitive aspects of a person's day-to-day ability to complete tasks independently. So having a registered nurse on staff as a provider is a good thing because the RN should automatically be screening for this. If there is or isn't a diagnosis, if it becomes apparent that the person is reasonably cognitively impaired, then the RN would think, I think I'll just screen for this supplement. Where it goes wrong for a lot of people, and we take these calls all the time from people, it actually happens a lot in the self-managed space. So self-managed providers, typically, they don't have registered nurses on staff. I mean, they might, but our experience is with self-management, if you needed a registered nurse, you would go and find your own registered nurse for whatever reason. Might be wound care, it might be a continence assessment, it might be screening for this supplement. What we find with self-managed providers is they tell their clients to go off to the GP to get this screening done. So people go off to their GP because it might be, I don't know, it might be free. They might be bulk billed. I'm not sure what the reason is. That's the automatic deferral, is go to your GP and get this done. A lot of GPs, or what people tell us, is that they make an appointment, they go along to the GP has no idea what they're talking about. And the GP tells them that they need a diagnosis of dementia. Well, we've already said that's incorrect. So people are sitting at their GP going, well, hang on, my provider told me to come to the GP. I've come to the GP. They're telling me, no, I need a diagnosis of dementia. My loved one doesn't have a diagnosis, and they get really confused. We also hear that in these instances where people go along to their GP, the GP will then defer to the practice nurse to do the screening. And in too many cases, the practice nurse also doesn't know how this works.
Yeah.
And the practice nurse will Google what to do here, and they're just really unsure. And we've heard of many people who have been sitting in the GP clinic for 3 hours or more waiting to get this screening done. And from my point of view, that's just not acceptable. If your older loved one is significantly cognitively impaired, just getting them out of the house in the morning to get to an appointment on time is a huge ask. Having them wait at the GP clinic for up to 3 hours is it's just not on. It's not okay.
No.
So getting this information across to our listeners today, we want to save you time and the runaround. GPs who are not familiar with this supplement and how the process works will also tell people that they need to go to the geriatrician, or they need to go to the geriatrician and get a diagnosis, and you don't. You do not. This is a straightforward and simple process. So would we encourage people to go to the GP? Well, no, we probably wouldn't, because we know that people just get the runaround, and having to wait for 3 hours at more at the GP clinic and then bringing your loved one home, that older person who's cognitively impaired, they're probably going to be quite agitated and unsettled for the rest of the day. And it's just unreasonable to expect a carer to have to deal with that. So it really is unnecessary runaround and time consuming. And if you spent all that time going to the GP and you walk away with no screening and no application form, what a waste of time that's been. So if we have listeners today who are thinking, well, I've got provider insert name, and mum or dad or my spouse, husband, wife, they've got some reasonable level of cognitive impairment, I would encourage you in the first instance to talk to your provider about doing the screening for this supplement, and then having a chat about, if the provider says go to the GP, if it was me, I'd say, what are my other options? Do you have a registered nurse on staff? Do you align with an organisation that has registered nurses? We do this screening for people on behalf of providers, so that's always an option. But I would just urge caution if people get that recommendation from their provider to go along to the GP, that actually you might get the runaround. Another thing, I was just thinking about another scenario that does come up, and it comes back to what we previously chatted about already, Shell, about who can do the screening for this.
Yes.
And the difference between screening for this supplement and diagnosing dementia. And the scenario is when the older person is in hospital. So we know that when older people in hospital and they're presenting as cognitively impaired, generally the treating team, which would be the doctors, it'd probably be the physio, the occupational therapist, the nurse, there might be other clinicians involved. In hospitals, occupational therapists take a big role in that screening for cognitive impairment. So they're typically the clinician who would be investigating a person's level of cognitive impairment and then having a discussion with the doctor. So we've even had people come to us and say, you know, my husband was in hospital and I asked the OT to do the screening for this and she did it and we got knocked back by Services Australia. Well, yes, you're going to get knocked back by Services Australia because an occupational therapist is not recognised as an authorised clinician for this process. So only those clinicians, registered nurses, clinical psychologists and doctors, cannot be an OT, cannot be a physio, cannot be any other clinician. And then being aware that, again, screening and applying for this supplement is a standalone process in itself.
Yeah. And Coral, I know we've even had people come back to us where they may have gone to the GP and the GP has either Googled it and worked out what they're supposed to do with the form, because it's not a screening tool that is commonly used, I think, is something that we need
That's exactly
to
right.
highlight as well.
Yeah, the PAS is not. I worked for 30 plus years in the public health system and I had not heard of the PAS when I stepped into community.
Yeah.
So it's not a screening tool that's commonly used in our clinical work, but it's specific to this process.
And the feedback or the situations we have come across more than once is the doctor has managed to do the PAS, but then has not realised there's an application form that needs to be done.
Yeah.
And so again, the person's only halfway to where they need to be. And I guess it's that understanding what the whole process involves.
Yes. Yeah, it is. Look, this is a topic that we feel very strongly about, having had our own dad who did have a diagnosis of dementia, but demonstrated eligibility for this supplement. So it did give us a few $1,000s a year extra in being able to keep him at home and give him the support that he needed. So we actually have a really good blog about this as well. I think we might include a link to our blog in the show notes of this podcast as well. And then if our listeners want to go and find out a little bit more about it, they can just check out the blog.
That sounds like a great idea. Well, I think we've covered everything to do with the Dementia and Cognition supplement. We know this is extra funding that many people aren't aware of, so we have a favour to ask. We would love you to share this episode. This topic and the funding could really help people who might not know about it or the assessment process. Look forward to speaking with you again next week. Hey Care community, thanks for listening to this episode. So you never miss a show, make sure you subscribe to our podcast. If you'd like to know more about what we do, head to our website, cmeacn.com.au.